I want to transition to a conversation we had on molecular HIV surveillance, or MHS. Um, and that is a really good example of challenges that science can face folks living with HIV, especially when there is no human rights or MIPA informing its implementation. And so I want to open this question up to all of the panelists. Can you further break down for us, what are community concerns with MHS, and what is a proper response to ensuring that those community concerns are met regarding the implementation of MHS? This is open to all.
Well, if no one else is going to answer, I mean, I think the MHS experts who we featured in the video, I think some of them are on the webinar, but I'm not sure they can answer. I mean, in our segment we highlighted a lot of the concerns, but I think the one that I didn't mention, and perhaps is the most obvious, is autonomy. Is like, it's our bodies, our choice. Whose blood is it anyway? And I think there's if people living with HIV and the organizations that represent us are not engaged in these complex conversations around how our blood or our data, but our blood in this case, is repurposed. We think we're giving blood in order to understand the best decisions for our treatment, for antiretroviral therapy, understanding resistance, etc. And instead, without us realizing it, it's being used to track the epidemic and treat us as if we are not people anymore, but that we're clusters. And because of the background of HIV criminalization, and the idea that even though it's not really possible to identify who infected whom through science, there's a lot of misunderstanding about it. And when we are engaged in clusters, particularly when the public health at a local level start to follow up on understanding of what's happening, and they actually can figure out who was involved in the cluster, and they can call up someone who's newly diagnosed and say, by the way, did the person that had sex with you, did they disclose their HIV status? And we know that that's been happening for a while in a number of US states. We have it documented for Michigan, for example. So there's a lot of concerns, and we are really worried that it's sort of happening, the idea that everything that happens with science is just magical and always in advance, and it's definitely better. Molecular HIV surveillance is the best way to end the epidemic, and we're not convinced that it is, but if it is a good way, then please engage with us and make sure that we're not treated as just clusters. That's the message.
Absolutely. Thank you so much for that breakdown, Edwin. I hear these concerns with autonomy, as well as, here in the US, I'm most familiar with, as I'm based in the US, is that there's a huge fear in the intersection of HIV crim and molecular HIV surveillance, particularly as it impacts Black, Latinx, Indigenous, and other communities of color. As we know that the coupling of public health and criminalization and tools that support that coupling place our communities at further risk of policing, surveillance, and criminalization. And so, I want to uplift a lot of folks in the chat saying, absolutely, Edwin, like, we are humans, we're not clusters. Even the way that, like, the terminology we use to talk about this particular tool is harm. And it's further harmed by creating another route to criminalization for folks living with HIV, the potential for it.